Hello, everyone. I'm glad you can make it today. As you can see, I am on the road, so I appreciate you joining us online. But I want to introduce myself. My name is Dr. Annette Bettis, your new mental health administrator of You Matter, Take Control. Here at You Matter, Take Control, we are dedicated to empowering individuals by promoting mental well-being, self-awareness, and resilience in the Corpus Christi area. In our public health outpatient program, we strive to provide resources, support, and education that encourage people to take charge of their mental health, build confidence, and navigate life's challenges with strength and positivity. Our mission is to foster a community where everyone feels valued, heard, and equipped to take control of their well-being. In a world of uncertainties, we want to ensure that community members find a safe space with our mental health program. And so I'm excited to share this draft business plan with you guys that our leadership team has been working on, collaboratively working together. This plan is not only a roadmap for our operational growth, but it's also a reflection of our values, our vision, and our ethical standards that we have here at at You Matter, Take Control. So I want to start off first with our goals and what that'll look like for the next 3 years as we're building this. And number one, most importantly, is to expand our access. We want to increase our service capacity by at least 30%, especially to our undeserved population within Corpus Christi. That is a population that sometimes gets mistaken for or overlooked. And so we want to make sure that we're helping our underserved population individuals. Number two, our goal is to enhance clinical excellence. Not only making sure that we excel above and beyond, but our goal is to maintain a 95 compliance with clinical documentation and providing monthly continuing education to staff. I think that's super important for not only our program, but for you guys in making sure that you're up to par with education and updates throughout mental health program itself. Number three is to strengthen financial sustainability. And we want to do that by improving collection rates by 25% and maintaining a positive cash flow. Number four, we want to advance equity and ethics by launching a community advisory board and tracking outcomes across diverse populations. These advisory boards not only help collaboration, but it helps our programs build a stronger sense of control, a stronger sense of teamwork and collaboration, not only for our program, but for the individuals that we are serving. And lastly, our last goal is to integrate technology. As you know, in an ever-changing world, technology has become one of the most important things to individuals. And so we are transitioning to a new electronic health record system to make sure that we're streamlining documentation and improving our billing accuracy. It's almost like a one-stop shop. We have everything in one location. And so now I want to talk about our financial backbone of our operation, and that includes three things: our collections, our account receivables, and most importantly, our cash flow. As we know, the financial health enables not only our clinical mission, but without cash flow, we can't fund programs or retain talented staff or provide even timely care. So I want to stress the importance of those things in making sure that we have the revenue and the cash flow coming in for our program. Number one is making sure we're meeting the timely collections. Claims must be submitted accurately and on schedule. We're going to have a 30-day delay in claim submission and create a bottleneck in our cash flow. So we're hoping that with that timeline, it kind of streamlines and helps that cash flow come through. Secondly, we're going to make accounts receivable by monitoring and implementing a monthly review, making sure that we're meeting monthly on that and assigning those case managers to ensure that our denied or unpaid claims are followed up with promptly. So having team members and staff kind of checking in with those individuals that have paid, that have not paid. How can we help? How can we support to ensure that they're getting the best care possible? And then lastly, making sure that we have a cash flow management. And that looks a little different, but we want to make sure that we're balancing income revenue with outgoing expenses. And so as it's coming in, we're outputting the information, outputting the payrolls to those insurance companies, and making sure that we're providing operational supplies for us, but even for individuals on a individual basis. And so we're looking at that to include a rolling 90-day forecast to our monthly financial meetings. And when we think of that, we want to make sure that we understand what our values and what our approach is here within our program. And as we've talked about in previous sessions, and what I've met with in our leadership team, is making sure that we understand that we're always transparent. We're always taking accountability and remembering that clients come first. That client first integrity is what's most important. When they feel valued, when they feel heard, they feel a sense of safety, and that's what we're looking at. So remember, these aren't just words. They're a reflection of what we live by, not only on a personal level, on a professional level, but how we're going to document, how we're going to bill, and how we're going to communicate. And so that brings me to a very serious ethical concern that I want to address with you guys when it comes to billing, documentation, and communicating. And so it has come to my attention that in a few of our recent cases, there were instances of incomplete or inaccurate documentation in clients' charts, which is one of the reasons why we're moving to online billing and online tracking system. But it appeared to be motivated, maybe perhaps unintentionally, but it still took place. And so by doing this, we want to increase billable hours and revenue. So let's be clear, right? So within those charts, it was noted, just some things that were just not correct and accurate. And so most importantly, guys, here within our program, that is very unacceptable. We have to maintain professionalism and make sure we're following within ethical codes. And so it puts our licensure, our funding, and most importantly, our clients at risk. And we don't want any of that to take place. So I truly hope everybody understands that, we really have to make sure that the teams that we're putting in place take a look at everything that is being documented, that we're reporting, and then it's done, obviously within due diligence time, but with integrity and respect to our program and our clients. And so with that being said, we will be auditing 10% of charts each quarter and implementing a documentation integrity training every month. Starting next month, we want to make sure that everybody understands that. And then any new staff that is coming in, they will receive that same training to ensure that they understand not only integrity in itself, but documentation integrity and what that looks like. We will also create an anonymous channel for staff to report unethical practices without fear of retaliation. So if you feel like you need to report something, you will do that through the online portal, and it will come straight to my office, and it's something that I can look into to ensure that we are meeting ethical standards and we're not putting ourselves and our clients at risk. So this is an opportunity, guys. Remember to model what it is to be ethical within a professional setting, but especially within our community-based outpatient care. We're here to help and support individuals, and we want to do that by not only committing ourselves, but many of you come with lots of knowledge and understanding, and so we want to make sure that we put all of that information to good use. So again, guys, I truly appreciate you joining us online for this virtual meeting, And remember that the work that you do is very impactful in this mental health setting. And here at You Matter, Take Control, we truly, truly appreciate all the work that you do for empowering us, empowering your staff, empowering individuals, and promoting the importance of mental well-being and self-awareness and resilience. So again, I am Dr. Annette Perez. I truly appreciate your time, and I hope you have an amazing day. Bye.